Dear Heavenly Father, Lord, creator of all things, we come to you this morning, Lord. We just want to thank you for this beautiful day you've given us, Lord. Thank you for the breath of life that we have in us, Lord. I just thank you for all the blessings you've given our people, Lord. I just thank you, Lord, for all the blessings you've given as the leaders of this great nation, Lord. I just thank you for all the blessings you've given our families as well. Just guide and direct us, Lord, as we make decisions for our people. Just be with our soldiers, Lord, in all fashions of life, Lord. Just comfort their hearts and give them peace of mind, Lord. Just thank you for your love, your grace, in Jesus' name. Amen.
Amen.
Next week, roll call. Please acknowledge that you are here.
Right at the top.
Ronnie.
Janelle Fulbright. Bill Anglin.
Here.
Bill John Baker.
Aye.
Jack Baker.
Here.
Harley Bezer.
Here.
Julia Coates.
Here.
Joe Crittenden. Jody Fishinghawk.
Here.
Meredith Fraley.
Here.
John Garvin. Tyler Glory Jordan.
Present.
Curtis Snell. Chris Soap.
Here.
David Thornton. Kara Cowan Watts. All I need, we do have a form.
Next, we have approval of the April 14th minutes.
Second.
First and second, all those in favor?
Aye.
Any opposed? Motion passes. Yes, sir.
Mr. Chairman, at this time, I'd like to amend the agenda to add item 1, which would be the resolution before you that about donating some equipment to the optometry school that's really just for parts, and Melissa has looked it over and she's good with it. Formal motion.
I'll second.
We have a first and second to add resolution donating equipment to NSU. All those in favor?
Aye.
Any opposed? No opposition. We're good to go. Next, we're to reports. And from the Claremore Service Unit, Mr. George Valera, you are the next contestant.
Good morning.
Morning.
Some of the numbers you see on the report, I'm trying to get better at this and get my report sent in time to get in your packet. You'll see some duplications from last month because I don't start getting my monthly reports till around the 5th of the month. But so next month you'll have all brand new numbers. But one of the big pushes we've got is in contract health. I signed 8 more chef cases to be sent in yesterday, which are cases over $25,000 to be sent in for reimbursement from IHS. So I've signed 8 more of those, and we have several more of those pending. So we're getting a real big push on those. Right before I left, I saw that we were right around 600 new charts, new or reactivated charts again for this last month. Also on collections, if we stay where we are, right now we're on track to collect over, we finally break that $12 million mark for Claremore. So we're really pushing that hard. Our ambulatory visits are going up in accordance with our new charts. We're anxiously awaiting word on the stimulus package. Our 2 big projects are the roof and the electrical system. I've heard rumor that the area is getting 1 CT machine, and that'll be coming to us. I haven't heard anything official about that yet. We're really anxious to move forward with that project. So as soon as I hear anything, I'll be sure to get that out.
Have any questions? I have one. Do you, when I was signing, you may have said something about I was signing something, but you see any major obstacle in this $170,000 you're waiting on from OHCA?
No.
Just what? Okay. Thank you. Any other questions? Thank you very much.
Thank you.
And next, I believe we're to Cherokee Nation Health Services. Melissa Gower, you are up.
Good morning.
Morning.
I provided a written report, so hopefully you've had time to review that. I wanted to mention a couple of things. One is that it's Nurses Week, and we sent out thank you card to all of our nurses, which now are, I don't know, I think it's a little over 200, but we are very appreciative. You know, nurses are the backbone of the health system and providing care to the patients. So they're very valuable to our health system, and we just wanted to recognize them appropriately this week. The second thing is that I asked Dr. Grimm if she would give you a short update on swine flu. And so, Mr. Chairman, if that's okay, I'd like to ask her to do that.
That would be great.
Good morning.
Good morning.
I love this because this is a just out. It's not the official update, but the unofficial update. So, as everybody knows, the swine flu, which is the H1N1 flu or the novel flu, which they're now calling it, they keep kind of changing the name on us, is a combination of a couple of different strains of flu. It has the same typical flu-like symptoms that you would get with any flu: high fever, body aches, cough, runny nose. Some people are getting a little bit of vomiting and diarrhea with it. The good thing that has bared out of this is that it tends to be a less virulent strain, so there's not a lot of deaths associated with it. That's good for us. It tends to be on the same frequency that the regular flu is on. The one thing we've really been trying to stress to people is that, you know, last year and all the years prior in the U.S., you know, you get 36, 37, sometimes higher, 1,000 deaths a year from regular flu. And we aren't seeing that kind of numbers with this. As of just a minute ago, CDC is now reporting 3,009 lab-confirmed cases in 44 states and the District of Columbia, with an additional 643 probable cases, which brings the total to 3,652 cases in 46 states. And so far there's been 3 deaths, with the last death being a 39-year-old that was reported on Sunday. In the state of Oklahoma, and this is still of last night, I haven't looked at the new one yet to bring it up, there were 20 confirmed cases in the state of Oklahoma. Kansas had 18 and Texas had 179. There's one probable case in an ITU facility in Oklahoma that has not been confirmed yet, but will probably be confirmed today. The thing that we're getting in Oklahoma now is a much quicker confirmation, because the public health lab in Oklahoma is one of 10 public health labs in the U.S. that can actually do the confirmatory testing. So we're getting results quicker. People who have still been, you know, it's still people who are exposed to somebody who has had it, exposed to somebody who's recently been to Mexico or has been to Mexico themselves and have those symptoms, are considered at high risk. If you have those symptoms, you do need to go in and get checked. We've put it at the complex, I don't know if anybody's been in it, but when you walk in the door, and that's what we have at our clinics, there's a little station there that has masks to wear, has hand sanitizer and Kleenex. The most important thing in preventing it is just like preventing any other flu. It's spread by respiratory droplets, so you know you don't want to be careful and keep a little bit of distance from people who are sick. You want to teach people, kids especially, how to cough and you know cover their face when they cough, and then using a lot of hand washing, you know, very good hand washing techniques, and then just the sanitizer. The one thing that this has done, and we're very happy that it hasn't turned out to be as virulent as people had worried. That could change. It seems to be probably a fairly highly mutatable strain, so it could mutate at any time and make it a little bit stronger. So this is giving us the opportunity to work and practice our pandemic flu plan to make sure everybody has the supplies, make sure everybody knows what to do in these situations, to educate the population at large just about, you know, preventing the flu in general, because this looks like it will go on into fall, and it's going to hit our regular flu season. So then we're going to have regular flu and we're going to have H1N1 flu, which will probably make things a little bit more complicated and worse. The good thing, though, I think will come out of it is I don't think people realize how many people die every year from regular flu. So I think we'll have a better vaccination rate, because by fall they will have a vaccine for H1N1 flu, and so people will have to get 2 vaccinations. They'll get, regular flu vaccine, and we'll get a flu vaccine for H1N1. So we'll probably actually get a better immunization rate among everybody just for general flu. So we've been meeting on a regular basis. We have another emergency management meeting, I think, this week, and another one next week scheduled. We're trying to keep people up. The one thing, I think the panic has gone out of the general public, but we really want to ramp up because you never know if it's going to, there could be a mutation or just even for the fall, for the flu season. So we're trying to make sure we've got everything in place. So does anybody have any questions?
Counselor Soul.
Yeah, I've got a question, Dr. Green. You mentioned a little bit about supplies and the fact that you've got the hand sanitizer and the masks, and it's really interesting to me because when you see, on TV, you see the reports from Mexico, and everybody's got the surgical mask, and it's my understanding that there's a worldwide shortage of these supplies.
Yep.
And so as that's a primary barrier for, protecting yourself or, individuals that may have symptoms, how prepared are we? You mentioned that we're reviewing those inventories and so forth.
We are. We've asked all the clinics to order double the amount that they would normally keep, and then emergency management's also ordered some. The surgical mask, we are the kind that we just ask for patients to put on if they have those symptoms. If you're a healthcare provider, and this will actually become a pandemic, then you would need a different kind of mask, and we have ordered a lot of those. So I think we're getting prepared, and it's not just the mask. I mean, if it were to get severe, you need to make sure you have masks and gowns and
Right.
Face shields. So we're getting all of those things.
I just find that interesting because as the photos progressed in Mexico, everybody started out with the surgical type protection, and then after a while, it was probably what I would have to resort to is a bandana or something like that. So it was just kind of interesting, and in those instances. I'm sure this won't be the only outbreak of flu, so it didn't take very long for there to be a worldwide shortage.
Yeah,
It's kind of interesting.
And part of the, at some point, depending on how this evolves, we need to probably spend some more time with the council because, part of our plan is elected public officials. We have in our plan, what we want you to do because we want you to be protected, and we will supply you with an N95 mask, which is actually fit tested to make sure it fits you. And then we would actually, really how bad it got. Sometimes we would ask you to self-quarantine so that you're available to still continue to do Cherokee Nation business on behalf of the tribe, and you might have to be doing phone calls instead of public meetings and those types of things.
Councilor Buzzard.
I've got a couple of questions, Gloria. Are we putting any of this information out in Hastings and in the clinics, how to do that? And then are we providing any hand cleaners or masks at the clinics and Hastings?
We are. At the clinics, they have kind of similar little setups like we do. We started last week. We have just a little trifold brochure that we give out to patients, and then we've actually had our public health nurses going out. I stopped at research, and they were actually handing them out at research, public health nurses. So they're trying to get out to the communities and get those out.
And then the vaccine for the flu that's now, is there a vaccine for this particular flu, or will it be developed?
It will be ready by fall.
Okay.
They're working on it, and they are sure that it will be ready by this fall.
Thank you, Mr. Chairman.
Councilor Fishing Hawk.
Go ahead like Chris, because this ain't about the flu.
Do we have the time frame identified from when it was identified in Mexico, I guess the initial outbreak, to the time that it migrated to Oklahoma in the first case?
It was
Just in general, I'm just kind of curious.
5 to 6 weeks.
Okay, so it was actually that long before it
And the people, the first people in Oklahoma that got it actually had been to Mexico.
Right.
So
And so that's what was kind of interesting. It wasn't.
And actually, in the United States, almost all the people that originally got it got it in Mexico. Yeah, and that's the other thing. There's a couple, CDC's revised some things, and the CDC and the World Health Organization have had differing opinions on travel advisory. The World Health Organization did not put any kind of travel advisory out. CDC said that you should limit any non-essential travel to Mexico. So those are a little bit differing opinions. But if you have to go, you need to know where you're going, know what the risk. If you're going to Mexico City, it's going to be a higher risk than if you're going somewhere else. Make sure that you have, a mask and hand sanitizer and all those kinds of things with you, and use some social distancing techniques. So that's important. The other thing that CDC did, which was interesting, and you guys may have seen on the news last night, is when it first came out in the United States, they were recommending that if there was one case in school, that you close the school down for a week. And CDC has since revised those guidelines and said that you should keep the school open. And there's a school in Tulsa, and they made the decision to keep the school open. So.
Council, Fishing Hawk, I was writing, did you defer, did you answer? Okay.
Yeah, because this was affecting with that one.
You don't have anything else?
Yeah, I do.
Oh, go ahead, you're up.
Okay. My little sister's up at Cherokee, and she got called in last night to do surgery about 4 o'clock in the morning while she was doing it with Dr. Thomas, who's the chief of surgery. He started talking, and the program director up there is Dr. Shroop or Sharp. I met him one time. They're wanting to know who they need to talk to, or if they can talk to you about setting up a program. They want to work for Dry at an IHS or something, and they're interested in sending their surgeons down here to Hastings. Or maybe Claremore, I don't know, but they're wanting to know. They called me early this morning and asked me to find out what they need to talk to you about.
They can call us and we can do an agreement with them. And
would y'all be interested? Because they was wanting me to ask questions about how many surgeons you got, what's the behavior.
yeah, because we have different, we have residents and from other places that
These will
come.
be all 4 years.
That come and do rotations with us.
Okay.
So yeah, we definitely like that.
At the meeting, so I can give you the information.
Yeah,
Thank you.
great.
Any more questions? I think that, I just wanted to comment, you touched on this, is one of my issues with the media is that, there's people that die thousands of people that die every year from the flu. The difference in this is that this is a little bit different gene combination. You got avian, you got swine, you have human, and it's crossed several times. And, the media kind of picks up on that like it's some exotic, whatever, it's a real threat, but we face that every year.
We do, and I think that's what people don't realize. Just plain old influenza A, continually mutates, and so that's why sometimes the vaccine works better than other times. They have to kind of predict on, what combination it's going to look like. And with this one, I think it just, and there's still a little bit of debate of what the combination is. There really avian flu in the mix. They're having all these big debates about it, and since it was a combination of multiple types, does that make it more likely that it's going to start having mutations? It's all theoretical, but
I've read they've been using Sanamifir and stuff like that. Do you have any reports on the efficacy of any of that?
It's been very. If people start it, when they know they have it, very quickly within acquiring it, treatment's very successful.
Pretty quick. Thank you. Councilor Buzzer.
A young child with a runny nose, should a person take him to the doctor to see that, or what should you do to monitor something like that?
The one big thing is fever, because the other thing that we're getting right now is the rain's finally maybe stopping. Allergy season's kicking in. Lots of pollen, lots of allergies. And so there's a lot of people that are having runny nose, all the postnasal drainage, which is causing a little bit of cough, but they're not having the fever. And so it's the fever that kind of sets it a little bit aside. So once you start having a fever and, pretty significant body aches, then...
And other questions? Chair, I see at Hastings we went to private rooms, which I'm glad to see that. And is it because you get well faster, or because we didn't have patients to fill up all the rooms, or you just felt like that was the best thing?
It's a combination of reasons. One, if you ask patients, they prefer private rooms because a lot of times they have a family member that stays with them. It's from a standpoint of just infection control, it's better to have one patient in a room. The rooms are still, several rooms are still available if we would need them because of excess patients, that we can make them into 2 beds again. We're just going to wheel another bed in there. And in some of the rooms, we've actually kept the second bed. Like if we have a child, then it's a bed for the parents to sleep in. But we can convert those really easily back into double beds if we need to, so we have the beds stored. But mainly it was, for patient comfort and satisfaction and privacy, and then infection control.
I think that's a good thing. Thank you, Mr. Chairman.
Councilor Fisher,
One more comment. I was going to just compliment Dr. Randall's doctor?
Mm-hmm.
I took my son to see him the other day. He's wonderful.
Great. Good. Yeah, he's really good.
anything else? Thank you.
Thank you.
Melissa, you have a...
I don't have anything else. If anybody has something on it.
Well, we got to Councilor Baker, you're up first.
Someone just said before. Okay, sorry. Just want to make sure I get everything.
What, page 20?
What did you say?
Page 20,
Okay.
third-party collections,
Mm-hmm.
less than 12 million, compared to 17 million.
That's correct.
19 million 2 years ago.
Mm-hmm.
When do you think we'll get over that bump?
Okay. We met about a week and a half ago, or maybe 2 weeks ago, after we got the contract signed and the entered and permission to start billing. And the billing staff had done an assessment. There was about 11,000 claims that had to be billed. And they gave me a time frame of 45 days. So with that said, by the end of June, we should be caught up. Now, whether the revenue is all in by then, it won't be because there's a lag. But as far as getting caught up on the claims.
Okay. So, best guess when revenue will level out, match, or be above, or whatever.
I don't know that. We're just going to have to keep monitoring it to see, when it starts coming in.
But we'll keep this chart in here.
Oh yeah, that's a standard chart.
Okay.
I have no intentions of changing.
Councilor,
That's it.
Councilor Snell.
No.
Melissa, can you provide us with a number of patients that we see with smoke-related diseases in our clinics and hospitals?
That's just the diabetes and the,
Smoke-related diseases. I don't know. I'll check.
And can you check and tell us approximately how much money this is costing the Cherokee Nation to provide health care for these patients?
I'll check.
Okay. Thank you.
Councilor Buzzard.
Back to the third-party collection list. Do you feel like that we're really getting all the third-party collections from our clinics?
Yes.
I know we talked about that before. And
You got the information I sent you, right?
Yeah.
Okay.
But do we have a person that, and you probably do, that goes in and does goes in and pulls, say, 50 charts and goes and sees that accident. So you do have.
We do chart documentation. Yes, absolutely.
So you do check. Okay, thank you.
Councilor Garvin.
Thank you, Mr. Chairman. As the people check in the clinics and so forth, it takes a little while to go through their insurance and all that. It's kind of bottleneck. But last night we put some more work on it. I don't know if you're aware of that, but we're going to put registration forms and both Cherokee Nation and state. And,
That's just make available, right?
Right. I don't know where you're going to put them, but it'll kind of slow the process down a little bit, really, but it's important. all Cherokees vote, and that's just one way we thought we had to reach the people.
Well, I haven't, went to the AG and got an opinion or anything, but what I thought the act was an act to make those forms available at the facilities, which has nothing to do with my registration clerks. The forms will be available, but we won't be actually setting and helping people fill them out and all those kinds of things. So I don't anticipate or see that is
So
a
they're just gonna be sitting over
workload.
the
They'll be
corner, so-
available. Which we've really had them available pretty much all along anyway.
I think it'll help. Thank you, Mr. Chairman.
Are there any more questions? Thank you. Old business, it appears we have none, and new business, we have a resolution. Here, Mr. Baker.
Yes, we talked about it yesterday, and then it's been passed out to you today. It's merely a resolution to get some 7 pieces of equipment out of our inventory, and that they keep having to go over to the school and inventory that is really just for parts, and I move that we make this donation.
We have a second. We have a first and a second to donate this equipment to NSU, the College of Optometry. All those in favor? Aye. Any opposed? Motion passes. Next, we're to announcements. Are there any? We have announcements, Mr. Garvin.
Sprinkler Prairie, they wanted me to make this announcement for her. You have this in your box concerning the Intertribal Council in Norman on May the 21st and 22nd. She said all the council is invited, so not just the Intertribal Council people, but everybody on the council.
That one more free.
You need to turn in to Gail if you want to go. Thank you.
That was it. Any more announcements? We are down. Oh, I'm sorry.
Are we still considering moving this meeting to Monday?
I have not heard anything about it since the last time we talked about it.
Would there be some point where we as a committee could take that up?
Let's. I think next time we can. Let's sit down and talk about it and plan on it next time. Okay. Councilor.
At the next health meeting, I would like to update you guys on 2 items, the National Children's Study and then comparative effectiveness research.
What was the second one, I'm sorry?
Comparative effectiveness research. It may not be me, it may be someone on the list as well.
I know you do, you're right faster than I do.
Will there be resolutions or?
Will there be resolutions on that, or is it discussion only? Or
It's just discussion only to inform the council about things that I've been working on nationally that are going to affect the local community.
And make sure that
Thank you.
Anything else?
Move to adjourn.
We have a first and second to adjourn. All those in favor? Any opposed? We're adjourned.